Today we're going to be talking about prematurity in Munster, Indiana. Community assessment. We assess Munster. This is located in North Township, Lake County, Indiana. This is located near the Illinois and Indiana border. It's also 30 minutes away from Chicago. There are a total of 23,614 people as of July 1st, 2023, living in this community. The median age for this area is 45.3 years of age, and the percentage of the population is 52% female and 48% male.
So next we're going to talk about the strengths and weaknesses. So some of the community strengths, the number one being the access to healthcare. There are a variety of hospitals within Munster as well as clinics. This allows more access to prenatal care, and individuals can choose where they would like to receive prenatal care as well. Next is safety. There are a lot of policemen employed as well as fire stations. This allows people to feel more safe in their neighborhood, especially if they're thinking about starting or raising a family in Munster. Next is that there is a very strong school system. There are a variety of public and private school systems. And a better education makes one more likely to participate in healthy activities, as well as makes one more likely to be able to afford a healthy lifestyle, as well as afford a healthy diet. Also, Munster is very close to Chicago. This allows one to have access to the jobs in Chicago, as well as different resources that Chicago has to offer. Finally, there are a lot of recreational activities. There are a lot of parks, there's some golf courses, there's a skate park, a variety of things where people can be able to exercise. In addition, there is a very long walking path, and physical activity and exercise is a very important aspect for the health of pregnant women.
As with all communities, Munster also has some areas for improvement. Some of these weaknesses include lack of public transportation, high number of fast food places, and lack of access to grocery stores. As mentioned, one area for improvement would be having more public transportation systems. As of right now, Munster's only form of public transportation is taking the bus, which transports people outside of the Munster area. This could make it very difficult for pregnant women to get to their doctor's appointments if they do not have a car, preventing them from getting the prenatal checkups they need and potentially increasing the number of premature births. Another weakness within the community was the high number of fast food restaurants and the limited number of grocery stores. This leads to Munster being a food swamp, which means that there are more unhealthy food options than there are nutritious food options. In areas like these, with limited access to healthy options, it is more likely that mothers will not be getting enough of the vitamins that they need to support their pregnancy, which can lead to their babies being born premature and potentially malnourished.
The first intervention would be to build more bus stations throughout the town. Munster only has one bus station, as stated before, which would make it difficult for those that do not have their own vehicles to travel to things like doctor's appointments or grocery stores. Farmers markets would be a good intervention because Munster is filled with fast food places and restaurants. Access to healthier foods is important for pregnant women so they can remain healthy in order to prevent health risks like gestational diabetes, cardiac issues, or premature births. Lastly, nutritional education is vital for mothers in order to prevent nutritional deficiencies in themselves and their children, which impacts short-term and long-term health. The education should be tailored to their lifestyle and their affordability. A free nutrition program could be an option as well because it would incline more women to be open to learning how to eat healthy for themselves and their children.